My name is Margaret MacGregor. I'm a practicing neurosurgeon in Nashville, Tennessee. Today I'd like to talk about an important but often overlooked cause of low back pain. The sacroiliac joint is a ligamentous joint that connects the sacrum to the iliac, not a joint that we think of as being highly mobile. Only moves 1 to 2% in males and 2 to 4% in females. SI joint pain is caused by a dysfunction of the sacroiliac joint. It is often seen in patients who have already had, for example, a lumbar fusion, in women who have given birth. There are studies that suggest that 15 to 50% of patients with chronic low back pain may have some component coming from their SI joint. Patients with sacroiliac pain typically complain of an aching point just off the side of midline in the low back. They'll often complain of difficulty changing positions from sit to stand, of difficulty with activities of daily living, including sleeping, lying on one side of the body or the other, pain wrapping around to the groin, as well as even numbness and tingling that may mimic sciatica. To diagnose SI joint pain, I rely on the history that the patient gives me, as well as a thorough physical examination, not only of the low back, but also some typical exam maneuvers that will help determine if a portion of the pain or all of the pain is coming from the patient's SI joint. I will often use injections, both of local anesthetic or combined with a steroid, and if the patient's pain is relieved for a number of hours or longer, this helps confirm the diagnosis. There are a number of steps that we go through from a treatment standpoint: physical therapy, injections, even immobilization, like using a brace or an SI joint belt. If a patient fails conservative management, then surgical intervention is considered. With the patient under general anesthesia in the operating room, I will place 2 or typically 3 implants depending upon the patient's anatomy. It's a procedure that is done with the assistance of intraoperative fluoroscopy, meaning X-ray guidance, and it usually will take about an hour. I like the iFuse systems because it is something that has been proven in over 65 peer-reviewed articles, and patients typically have a 90% satisfaction rate after the procedure is completed. Our office is happy to see new patients to be evaluated for SI joint dysfunction or sacroiliitis.